I'm on the shore of a huge inland sea, a great body of water that goes for hundreds of miles in that direction. Literally, I could probably walk 50 miles into the water and still not be over my head. It's that shallow. It's mostly dead, but there are, you can see out there, birds sitting in the water. It is teeming with life further out you get, and it's surrounded by mountains, huge mountains all the way around, a bowl of mountains. This is like the future of medicine in that it's analogous to the unfolding genetic diseases that we're discovering out there. In 2003, the Human Genome Project was completed. It was a landmark, a huge milestone for the human race, that we had mapped the human gene. And from that, we were able to compare what a normal gene structure was to what's out there in the population. And we discovered hundreds, if not thousands, of gene errors and gene defects and transcription errors and everything else that we as Americans were living with every day. And so what we determined was that all these gene errors and gene defects, most of them affected our ability to make certain key enzymes on an intracellular basis that affected our ability to utilize certain vitamins and minerals and proteins and amino acids, again at an intracellular level. The naturopaths and the doctors who deal with more natural issues have gotten a hold of this. We MDs have missed it. We DOs, we MDs, we Western physicians have missed the gene disease switch that's going on out there. This landslide of genetic issues that are occurring. Other doctors, other naturopaths and chiropractors and nurse practitioners have gotten a hold of this and ran with it while we sat back and prescribed our Band-Aids. Have you ever had a patient who got violently ill when you tried to give them their prenatal vitamins? They would start throwing up, had major problems with them. That's probably because for certain patients, folic acid is toxic, and you try and give them tons of folic acid like in prenatal vitamins, and it will nauseate them and make them throw up. Have you ever had patients you tried to give an SSRI to, and they became just crazy on it? They hated it. They wanted to get off it so fast that it made your head spin. It made their head spin, so you got them off of it. Or patients that you put on birth control pills, and they went wackadoo, and their husbands had to bring them in and go, or boyfriends, and get them off this birth control pill. Please, can we stop it? It could be making them crazy. What we found in 2003 with the Human Genome Project, where there were thousands of gene mutations, transcription errors, and gene errors out there that we had to deal with as a human race. For example, COMT, which is a liver methylation enzyme deficiency, again caused from a genetic error on the first gene, increased breast cancer risk 7-fold. So if you have patients with breast cancer risk, where the whole family has breast cancer issues and a high rate of breast cancer, it could be that they have the COMT gene. What we also found were there were more serious problems that affected people on a daily basis. They were being hugely misdiagnosed, and just not even known about. MTHFR stands for methyltetrahydrofolate reductase enzyme, and these patients have the MTHFR disease. Did you know that 85% of the US population, up to 85%, has the SNPs, or single nucleotide proteases, for the MTHFR disorder? That means they have one of them. Up to 15%, maybe higher, of the US population has 2 or more of the SNPs for MTHFR. So they actually have the disease, they have the symptoms. It's hugely misdiagnosed. It's thought to be chronic fatigue, it's thought to be depression, it's thought to be schizophrenia. It's just thought to be a number of huge things. It increases clotting risk, it causes problems with birth control pills. Some of them can't take SSRIs. It's according to what mutation or, transcription error they have, because it's not a gene mutation, it's a transcription error that's been repeated over and over and over again through the generations. You've got to picture this as a well, a methyl well, that is either full, that's a normal human with tons of energy, boundless energy, running all over the place, because methylation is critical for the Krebs cycle, the citric acid cycle, the energy cycle that converts glucose, which the human body can't necessarily use directly, into the ATP molecules, which are our energy coinage. The coinage of our body, the coinage of the realm that we use to move, to function, to have a great day. And so people with methylation issues can't make enough of the methylation enzyme, the MTHFR enzyme, to properly methylate B12, pantothenate, to handle magnesium, to handle zinc, to handle copper, just on and on, to detox, to make glutathione. For you doctors out there that doubt this is a disease, or have heard, it's not that big a deal, it's not a disease, really, tell 98% of the kids with autism spectrum disorder who have two of the MTHFR genes, who have the disease and can't make enough glutathione, that it's not an issue. That's why they store heavy metals. So it is a disease, and I'm going to show you lab after lab that proves that in my new book, The 85% Solution. We're going to discover a lot more of these as we go along. We're going to learn more about them. In the last 12 years since the unfolding of the Human Genome Project and what they discovered in that, we know so much more now. But the future of medicine is like this great inland sea. It goes forever. If I got in a boat today and started to slowly row across or walk across, which I probably could, for 50 miles, I would never see the other side. I would die of old age before even a smidgen, even a small number, a small percentage of the genetic disorders are discovered and figured out that we found with the Human Genome Project. But you younger physicians, this could change your life. If you haven't got on the boat to cross the sea, to learn about the genetics that are going to affect medicine so hugely, they're going to be such an issue as we go forward in the next 50, 100 years, then come with me. My new book, The 85% Solution, I talk about protocols, how to diagnose, when to look at these patients, what patients you should be looking at, and I go into very detailed treatment protocols too that are pretty effective. They're not perfect. This is an ever-growing body of knowledge, so it's an ever-growing book, an ever-growing work. Until the day I die, I'll probably never quit adding to it. So if you want to know more, if you want to know how to treat these patients, if you want to know more about what MTHFR is and the methylation problems these patients have and how they're so tired all the time because their methyl wells are empty, come with me and learn about this with my new book, The 85% Solution. Also, look for the companion cookbook and meal planning book for these patients. It can be really helpful. So come with me now and let's learn more. Come on, let's go into the inland sea and see what we find. Come on.